And welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Lavalaki. A massive thank you to everyone that have been following our social media pages, and especially right here on YouTube. Thank you for the subscriptions, the likes, the follows. Massive Nakavakalevu. Today with us in studio, we have none other than our very own specialist here at Oceania Hospitals, Dr. Waqainabete. And so welcome to the show. How are you?
Thank you, Echoes.
Right, just to get started, from the operating room to the parliament floor, you've had an incredible journey, from a surgeon, a professor to a minister of health. What inspired you to step into public service, and how has that shaped your approach to patient care here at Oceania Hospital?
Well, now, not everyone works in Fiji within the public service, in the realms of a public service. When I went into parliament, I was an associate professor at the Fiji National University, associate professor of surgery, teaching both postgraduates and undergraduates, and having worked in the public service for nearly 30 years, including 3 years as a medical superintendent. And so, you see the themes and wonder how we can be able to help change it in policy. And certainly that was one of the reasons why I opened my hand up to see if I can be able to get into Parliament. Unfortunately, there are times that I was appointed by the Honourable Prime Minister at that time to lead the Ministry of Health. And that was a relatively challenging time. We had a few cycles come through, 20 Cat 5 cycles and DC Lassa being one of them. We also had the measles outbreak, and then obviously COVID. And that was probably just being carefully and all the words, and also the window post-COVID. And so, and also during that period, I engaged with surgery as a whole, both nationally and internationally. When we had outreach visits, we took the baby, for example, went to islands, and there was a need in Ireland that had to operate. My license was still intact. The Fiji Medical Dental Council. There were a few occasions that I needed to come back into the hospital and help colleagues with the difficult cases in theatre, and also just being able to be part of the team whenever I'm around, having discussions. So never really left. So I don't know, the clinical works, but it was an interesting time. And at the end of it, is just it wasn't good to then also be able to step away and then use that the learnings in the everyday work, looking after patients as a teacher.
Thank you. As someone who is deeply involved in surgery initiatives, what are some of the key lessons that or innovations you've brought back to improve patient care in Fiji, and especially here at Oceania Hospital?
The surgery is part of a multidisciplinary, comprehensive effort to be able to make lives better, right? Sometimes they can include saving lives when people are in streams. We did an emergency operation, but certainly it's about being part of the team. And that's what surgery has happened in surgery over the last 100 or so years, when surgeons had accepted that they are no longer the head and everybody follows sort of thing, but they are part of the team. That's why. The other thing is that one thing we have to be very cognizant of in Fiji is and one thing that in my previous role I was very interested in is the social determinants of health. Is because sometimes we work as the main hospitals, we're not able to admit patients for an operation because there's an outbreak, certainly those with dengue led to whatever, may fill up hospital beds. So how is it that we can be able to reduce those issues or improve the social determinants? The simple thing is making sure that water is clean, making sure there's sanitation, and those also contribute back to disabling. So I think surgery is not a standalone discipline. It's very dependent on a team approach which also includes obviously the important role that anesthesists and nurses and other members of the team do. Even the orderlies being able to bring a patient into theatre, they play a very important role. So then you've gone away from the concept of, being a special privileged rod to accepting that you're just part of a team.
Thank you. Personal wellness and work-life balance is important. As someone who has juggled high-stake roles in both medicine and politics, how do you personally manage stress, maintaining your own health and well-being? This will be a good advice, especially for our viewers out there.
Yeah, so the very important, I mean, we have to read by exam. One of the things that really challenged me is being away from me when you have to 4 years in Missouri as part of the training, and that helped me to see how doctors and surgeons and healthcare workers really as people live in Missouri, somebody crashes and spend their farms enough. And people are very healthy. And also I've had some senior colleagues recently retired that's 65, 67, and they still look fit and healthy, running around healthy pie. And that's part and parcel of their life. So that was also helped in the period being able to look at being healthy. So healthy is being a doctor, being healthy is part and parcel of what we preach, but we also should be able to live by. In Fiji, for the last 8 years now, maybe 9 years now, we've had a touch team that originated in Albert Park even before I went into Parliament. And we do it. It's every hour. So now we have two groups, one remains in Albert Park. There's a group of us who are now based in USP. Every lunchtime, 1 to 2, we play touch, encourage one another. We show another group what we're having for lunch. We have our checkups every now and again. And I think we are a very mineral people. And I think it's important that we do it in communities. So, for example, a work-oriented one or group of friends, and doing it individually like the way they would do it overseas to people per se. So I encourage people to make a formal organizations team and encourage one another to health.
Thank you. Advancing in surgical excellence here at Oceania Hospitals, as a consultant, general surgeon here at Oceania Hospital, what sets the surgical care offered here at this facility apart?
Yeah, so obviously my big role is with the University of Fiji as professor. I teach undergraduates that are based here. I can see work predominantly at CWL. And I think one of the things, the good things about Oceania is the fact that we strive for excellence, not only in terms of what we do artistically, but also the science around it. Being able to have multidisciplinary meetings, have just this 1 year continuing medical education program, which I spoke on. So these are very important areas in which we can further develop ourselves professionally. I think the other thing is that I've seen a significant difference here in Oceania. When I was here before I was going into Parliament, I've seen a significant difference in the way that the processes have worked, the systems have worked. There's a lot of checks and balances in place to ensure that patients are picked up. Obviously the investigations are better, and these are all playing a significant role in being able to further the extent of the surgical intervention that we can offer. And again, as I mentioned earlier, surgery can only spread as much as the support is around. Yeah. So the more support is around, the more surgical intervention or competent surgical intervention can.
Thank you. Before we wrap up, patient-centered innovation. Oceania Hospital continues to expand its services and adopt new technologies. What recent improvements or upcoming initiatives are you most excited about here at Oceania Hospital?
I think the ability to see patients at home, so the home-based care that we've done, and it's obviously run by a doctor and with nurses. I think that's probably one of the best things that's happened, because obviously it allows us to have an extension into the home. And a lot of people are just comfortable in their own home, I think, seen at home. Some patients, certainly being able to, get up and come to hospital and then go back, it takes away quite a significant amount of time, even in the private setup. But also, more importantly, if you exhaustion with pain, and when somebody is unwell, it's just the security of being in their own house. So I think that's something that's obviously something that's done in New Zealand. When I was there, they keep quite often having patients visit into their own home, and I think that's a good integration that we started in Oceania. What I'm looking forward to is more this innovative methods by which we can be able to cross the floors and the hospital actually to the person, whether it be at home or workplace. And I'm also grateful that the group has started going around workplaces and then screening people, sending them back, and identifying people at distance so that we can be able to start working with them towards ensuring that they are healthy.
Thank you very much, Ruth, and thank you very much, by the way, for coming on to the show. And there you have it, ladies and gentlemen. That is just basically a brief insight into what we have here at Oceania Hospitals, the services provided, the services we offer, rather, and especially a brief insight into Dr. Ifereimi Waqainabete's life leading here to Oceania Hospitals. And here at Oceania Hospitals, we strive for the utmost high standards, patient care, and the clinical services. So from us here at Health Talk with Oceania Hospitals, until next time, Black Khalif.